Welcome to the 20th MedResults Network Educational Webinar and our very first webinar of 2016. I'm Jamie Parrott, President of MedResults Network, and as always, I just want to thank everyone for taking time out of your afternoon to attend this presentation. And I also want to send a special thank you to everyone who's been attending our webinars since November of 2014. We actually started our webinar series then, and we look forward to continuing it throughout 2016 and beyond. This past month, we launched 2 new vendor partners, one of which I'm delighted to welcome here today, and I'll get to them in just a minute. But you may have seen our recent announcements about Stemology. They're our new STEM-based and all-natural skincare line, and we are absolutely thrilled to be introducing them to the network. And for those of you who want to learn more about the line, I'm excited that we're going to be holding another educational webinar later this month. It's our next one. It's on February 25th with Stemology, and we're going to be discussing the efficacy of stem cells in skincare. So I encourage you all to learn more about the line. We really think it's an incredible complement to many other pro lines and cosmeceuticals on the market. As for today, I'm very proud to announce that in January we introduced our first new partner of 2016, Dermapen USA. When I was in Sydney, Australia last year, that was August last year, I actually had the privilege of meeting Dermapen USA's parent company, Dermapenworld. And strangely enough, I found out that their head office is about 15 minutes from the university that I attended years ago. So I was pretty excited about that. I spent a lot of time with their team at Dermapenworld. I was extremely impressed with their new products and their new USA distributor, which is why when I returned, we formed a new partnership with Dermapen USA, which we think provides excellent value to our members who are interested in or already provide skin needling services. Today I'd like to introduce Jeff Graham. He's the VP of Sales for Dermapen USA out of Atlanta. He joins us today to speak specifically about the treatment of acne and hypertrophic scars using microneedling. Although you're going to receive a ton of valuable information today, I'm encouraging all of you that are seeking additional education to attend Dermapen's upcoming U.S. Masterclass training tour. And I've sent out a few emails about that. It begins in LA and Orange County on the 26th of this month. And Dermapen has actually invited a world-renowned skin needling trainer from Australia to host all-day training events in nearly a dozen cities nationwide. Although MedResults members can attend any event that's offered by Dermapen, Dermapen USA has been kind enough to add 2 locations that are open exclusively to you all, to MedResults members. Those 2 events are in Chicago on March 14th and Boston on March 16th. We've already sent out postcards to our members in those areas about these events, but if you're interested in attending and you haven't received anything or you want more information, please reach out to me directly. And finally, before we begin, I want to remind you all that a 30-second survey is going to pop up with a few questions to capture your feedback after the end of the presentation. This is very important today to fill out, and this is because this is how you're going to receive your free copy of Advanced Skin Innovations, which, as I mentioned before, it's the Bible of microneedling. We'll be sending each attendee a free copy of this book today, just for being on this webinar. We ask for your mailing address in the survey so that we know where to send the book, so if you don't fill this piece out, you may miss out on your copy. Also, if you have questions for Jeff or you're interested in learning more about Dermapen or any of these upcoming training events, you can also use the survey to let us know. So without further ado, I would like to introduce Jeff Graham of Dermapen USA.
Jamie, thank you very much, and I'm happy to be here. So as many of you are probably very familiar now with microneedling and its advent in the world of aesthetics, what we're finding is that there's more and more applications to be used or where a microneedling device can be used. Obviously, the advent or the first initial start was with facial rejuvenation, that type of thing, seeing some before and afters, but the applications very quickly spread over the years. We were the very first to launch a microneedling device in 2008 worldwide. Came here to the U.S. and had a distributor distributing our products back in 2010. And while we dissolved that distributorship and that relationship, Dermapen Worldwide has still maintained quite a bit of momentum and still been doing quite a bit of extensive research. We have several clinical trials underway right now to look into various different modalities here, whether it be acne scarring, fine lines and wrinkles. Other applications that the Dermapen has been used or is being used currently is in the treatment of stretch marks, cesarean scars, your hands, knees. It's amazing what I'm finding, almost weekly with physicians telling me that they tried it on this. It's worked out beautifully. So I kind of wanted to just touch base with one of the real hot buttons, or one of the big areas of growth within microneedling, and that is the treatment of scarring, both with acne and with hypertrophic. So I thought I would just kind of go through a basic rundown here. This will be familiar to most of you, but even when I was putting this together, it still I learned a few little pointers that I thought were nice. So basically, what is a scar? It can be defined by a mark left on the skin after a trauma or an injury. And the damage to the dermis creates this deep structural change. And this affects the texture and the tone of the epidermis above. Now, very superficial damage only to the epidermis does not result in any type of formation of scars. Scarring is indicative of a defective wound healing process, and it can affect any skin type or color or condition or anything. And every significant wound or skin trauma results in scarring to some degree. Obviously, the greater the initial damage of the scar or the trauma, the more defective the wound healing response. And in turn, that leads to the greater scar size and the appearance. So scars can really be categorized into three different types. You've got your atrophic, your hypertrophic, and your contracture. So here's a look at an atrophic scar, which is basically a rolling scar categorized by the wave-like undulations, very superficial. And these are generally the result of mild acne. So most of you, I'm sure, are very familiar when you look at this type of skin. You see these patients in your clinics all the time asking, what can we do? What type of services can you provide? Here's a couple of before and afters I'll go through to kind of show you the benefits that the Dermapen or microneedling can bring. The box scars here are often resulting from a little more severe acne or post-chickenpox. And they're categorized by deeply depressed, rounded pitting with steep vertical sides. Again, you've probably all seen some of these come through your clinics with questions about what can they do to mitigate this or at least alleviate the look. Next, we've got the hypertrophic scars. These are commonly misdiagnosed as keloids. So keloids, again, is another hot button that microneedling can definitely address, and the Dermapen is excellent at addressing keloids. But not all keloids are hypertrophic, not all hypertrophic scars are keloids. So what they are is hypertrophic scars are characterized by their raised appearance. A hypertrophic scar does not extend beyond the original wound, whereas a keloid does. So in many cases, especially in the darker skin types, hypertrophic scars may be hyper or hypopigment. Basically, obviously, they can be very dark or very light. So contracture scars are more commonly referred to as burn scars, occur after the second or third degree burn. Now, as part of this healing process, the surrounding skin tissue rapidly contracts or pulls together. And you can see this oftentimes with your patients when they arrive and they have burns from an accident or sometimes even when they were a kid, and you can see how the body has then begun to stretch and affect the movement and mobility of that particular patient in that particular area. And it really affects the underlying muscles and tendons. So here is another before and after picture depicting a contracture scar on the chin of a patient here. And this is after several Dermapen treatments to kind of show you how it really helps to mitigate the overall look and helps to smooth and everything out. So how do Dermapen treatments provide effective results for these types of scarring? It works in three ways to help really effectively treat acne and hypertrophic scarring. First, it releases and breaks down the existing fibrous tissue within these scars. And second, of course, it promotes the growth and proliferation of regulated tissue via normalized wound healing. So when you're doing a Dermapen, you're actually creating a wound, but in a much more controlled environment. You're creating an injury, rather. And of course, it enhances the infusion of active drugs and chemical resurfacing mediums or serums to accelerate the treatment results. And we'll get into some of this here in just a little bit. So how long do the results last? post-treatment with using a Dermapen. Now, long-term scar corrections, can be achieved provided there is no further trauma, of course, to the treated area. One of the things that I often talk about when I have physicians call me, or RNs or estheticians, or when I do provide this, is this permanent? Is it long-lasting? And while it is, it's not like Botox where you've got to go back after 6 months after doing a cycle treatment of 4 to 6 Dermapens. But, of course, once you do get that collagen reformation and you get that nice skin rejuvenation, we do age. So, of course, down the road, several years, depending on the patient's skin type and what have you, you may have to go back and do a maintenance type of treatment. And, of course, with the depth and severity of acne and hypertrophic scars, we'll determine how many treatments may be required. And, again, we have some protocols on that as well. Generally, we go with 4 to 6 treatments spread out anywhere from about 3 weeks between treatments for the treatment of acne scarring and hypertrophic scars. So what active drugs or ingredients may be used during the treatment? We have our DP Dermaceutical line, which is we have our Hylactive, which is our hyaluronic molecule mix. And we have many, many clinics using that even without the Dermapen. It's just such an excellent medium by which to use when doing microneedling. But tretinoin here, as you can see, can be applied daily as a pre- and post-procedure maintenance. Obviously not during the procedure, but and this just helps to accelerate cellular turnover while also stimulating the fibroblast production to plump the areas of the atrophy and depression. So this, as you can see, combined with microneedling can really help to smooth out a lot of the different acne scarring that you're going to see. By adding tretinoin, it also provides greater elasticity and tightened fibrous deposits. So it's really an excellent adjunct treatment. And then you got your Fluorosil and your 5-FU. And these are just topical creams. All of you are very familiar with these, oftentimes applied right to a keloid scar or a hypertrophic scar immediately following a Dermapen treatment. These are also very productive and very effective when doing this in conjunction with a Dermapen treatment. And you can see down there at the bottom that you can apply the 5-FU to the treatment area up to twice a day prior to a Dermapen procedure. And then depending on the severity and the size of the scar, topical preparation can take 2 to 6 weeks of application to help flatten the appearance of the raised scars. And of course, your triamcinolone, injections, your steroid injections are also another very commonly used procedure in reducing or flattening hypertrophic scars and keloid scars. Again, you guys are probably all familiar with using this type of a regimen to some degree already. But when you combine that with a Dermapen treatment, you can really help to smooth out the overall appearance of that scar, not just flatten it, but helping it blend in with the existing skin type around it. And of course, most of you have heard lately a lot of talk about platelet-rich plasma. And obviously, this is just the autologous platelet-rich plasma injections or topical infusions. It also releases further growth factors to help plump and reduce the appearance of scars and acne scars. The application of PRP should commence. You can do it prior or immediately after a Dermapen procedure, and we obviously have clinicians that are using it during the Dermapen procedure. So the sky is really wide open on this as far as where you want to administer this. But and the specialized growth factors themselves produced by PRP, and I've stated a few of them right here that you can see as to what they provide. Whether it's for cellular and vascular regeneration or for rejuvenated function. So all of these protecting, the white blood cells for increased defense. All of these different specialized growth factors are some of the benefits that one can achieve by using PRP. And so the benefits of using the Dermapen for the treatment of acne scars and for fine lines and wrinkles and hypertrophic scars and everything is that really, no matter what you're treating with the Dermapen, you have very minimal downtime. Most of your patients can be back to work the very next day. Sometimes they look a little red, like they've been on the boat over the weekend, but nothing that can't prevent them from getting out and functioning. Another very effective use for the Dermapen is the fact that you can treat all skin types, from Fitzpatrick 1 all the way through 6, and not worry about hyperpigmentation after the application of a Dermapen treatment. And the Dermapen treatments are very cost-effective when comparing to a laser treatment, be it a Fraxel or some type of CO2 that can be very invasive. The Dermapen treatment provides that option for your patients, that their price point is much lower, and of course the downtime oftentimes is much less. And because the Dermapen does not use any heat or chemicals to cause this injury, and you're not removing the top layers of skin, that's what helps to improve the overall downtime or lack thereof with a Dermapen treatment. So all those images I produced were a compliment to Dr. Hassan over in Egypt. That concludes my presentation.
Yeah, Jeff, do you want to tell everyone a little bit about Dermapen and maybe its functions and some other opportunities they can use that in their practice?
Sure. So one of the ones I just mentioned was PRP. We are launching our PRP solution here. And many of you may be familiar with PRP. Some have thought about it. Some are already doing it. PRP can be really very effective. And, you know, the fun side of this is the fact that PRP has been around for 15, 16 years in orthopedics. So you go to any orthopedic surgeon and they'll tell you exactly what PRP is, and they most believe in it, they get it, they understand it. It's really starting to make its way into the aesthetic field now. And we have countless physicians that will go ahead, pull the patient's blood, spin it down so you get that platelet-rich plasma. Some of these, including ours, will allow you to do a dual spin. So you'll spin the blood again once you separate it, and you'll be able to get some pure PRP. So anytime you're doing like an O shot, a P shot, a breast lift, or you're going to be injecting PRP into the patient, you really want to use pure PRP. But what I'm finding is that many physicians will inject PRP prior to doing a Dermapen or post-procedure. And a lot of physicians will use just standard PRP on the skin with the HA and go ahead and Dermapen that right into the dermis. So there's many, many uses for PRP and PRP that coexist with a Dermapen treatment.
Well, I appreciate that. I want to share with everyone that just stress the point that Jeff mentioned, that the Dermapen is exceptionally effective when used in conjunction with a topical. So if you all are interested in learning a little bit more about that, or just in the mechanics of Dermapen or different modalities, Jeff can speak with you directly and spend some time with you on that. And whether you're using a microneedling device already or you're exploring it and exploring the idea of bringing one into your practice, we have a great resource in Dermapen and in Jeff, and they're happy to share any information you need with you at any time. So just to drive it home, this has been a very brief presentation, but I want to stress to everybody that you will receive a copy of the Advanced Skin Innovations, the second edition. It's the Bible of Microneedling, as I mentioned at the beginning of the presentation. Simply fill out the brief survey that's going to pop up in just a few minutes here after the end of the presentation, and share your mailing address and information with us, and we'll get that out to you. Also, like I said, you can certainly reach out to me with questions. We'll forward that on to Jeff. There are plenty of other modalities for skin needling devices, and we will be continuing to share more educational presentations with you throughout the year. But in the meantime, I encourage you to check out Dermapen and contact us directly. So with that said, thank you everyone for attending today. The recording will be available, again, if you want to review any of this information, on our website at MedResultsNetwork.com. Take care and have a great afternoon.